Hi, Julia. My name is Katie, and I'm a charity officer at the BHD Foundation and Myrovlytis Trust. So we are a medical research charity raising awareness and funding research into Birt-Hogg-Dubé syndrome. I'm really delighted to get to talk to you today about one of the symptoms of BHD that I think is probably one of the most overlooked, especially from a clinical perspective, but can have really serious impacts on a person's life. And that's the skin bumps or fibrofolliculomas. But first, I'd like to kind of know a little bit about your history with BHD and kind of when you were first diagnosed with BHD and how you went about that.
Yeah, sounds great. Very happy to meet you. My name is Julia Thierauf. I'm a surgeon and a scientist, and I was diagnosed with Birt-Hogg-Dubé. Actually, it's closely related to my work because I transitioned from being a surgeon into a postdoc position in the United States in molecular pathology, and I told my boss a little bit about my family and that my mother was recently diagnosed with bilateral oncocytoma of the parotid glands, and he saw the skin bumps in my face, and he kind of said, I think you should get genetic testing for Birt-Hogg-Dubé. I think you might be a patient. And that's how I got diagnosed, and that is almost to this day 2 years ago. So very recently, when I was 34.
Yeah, that is a very recent diagnosis, and it's great that you highlighted the fact that you're a surgeon and a researcher as well, and a patient for BHD now. And I know that you might be hoping to start some research on BHD, and that's really exciting. And it's great that we get to see all these perspectives kind of from one person. That's kind of one of the aims of our charity, is to bring together patients, clinicians and researchers, and you fit that box almost perfectly. So you said you had a family history of kind of some of the symptoms of BHD, but when and what were your first symptoms?
Going back, now that I know more about Birt-Hogg-Dubé, I can definitely say that I got the first skin lesions on my thorax and in my face when I was 20, 21 kind of. And it was pretty hard because, you come right out of puberty and everyone else's skin gets flawless, and you develop these, lesions, and nobody really knew what they were. And it was, I remember that quite vividly, actually, that I developed that when I was, around 15 years ago, I would say.
That's pretty tough to deal with as a young person who, is just kind of finding their feet in adulthood, and then you find that you've got something else to deal with. Have you had any other symptoms of BHD, lung or kidney associated symptoms?
My kidneys were always fine, and actually I have my annual MRI coming up tomorrow morning. Also, like I said, it has been 2 years now, and we kind of stay within the time frame of the annual screenings. So that's one exciting part. A little scary, but I hope it's going to be fine. And then in terms of the lungs, I've always felt that my lungs were not the best. I've always done a lot of sports, have competed in martial arts, and I definitely can say that I have a lung affection on my left side. I can feel that. However, I never got, when I got diagnosed, I had kind of the choice. My oncologist gave me the choice of having a CT scan of the lungs or not, because I'm also from a medical perspective, and since I'm a physician myself, I have that rule, and I say always, when it doesn't have a clear therapeutic consequence, then I'd rather not want to know, because I'm kind of scared that it would alter my everyday behavior. And I know that that this can be discussed definitely from a medical perspective, but for me, it has always felt good not to know every single detail of what's going on in my body. And I mean, for the kidney, it's definitely different, because that would have a clear therapeutic consequence in terms of surgery and knowing cancer early enough. But I feel like for the lungs, as far as as I can do my everyday sport program, I'm fine not knowing. And obviously I don't go diving or things that could potentially risk my lungs.
That's really good to hear, that you're getting your regular kidney scans, and fingers crossed everything looks okay on them. And it's really interesting to hear about your perspective on the lung cysts. And I guess that's the benefit of you being both a patient and a doctor, so you can see it from both sides. So it's really interesting to hear that. So it sounds like your kind of lungs and kidneys are okay. So has the skin kind of been the most challenging aspect of having BHD?
Yeah, I would definitely say, I mean, going back when I was 20, I mean, I've gotten used to it. I've lived with it for a very long time now. And knowing what it is definitely helps, because it was, I've heard, and I don't blame anyone here, because it's a orphan disease. It's so rare. I hadn't heard of it before I got diagnosed, basically. Like I said, I don't blame anyone, but I've heard various things about my skin, that my hygiene was lacking, or that I should get more facials, or that I should just take better care of my skin, and that those were just impurities that would go away, or that my hormones were imbalanced, and all those things, that where I was like, yeah, no, I have tried everything. They're there, and they're not impurities, and I can see that. But and I got lasers, and it was really tough when you're a young adult, I would say, because like I said, everyone else's skin gets kind of perfect and out of puberty, and you're left with these skin bumps. And on camera you can't really see them that well, but definitely when the light is in like the wrong position. And it always kind of forced me to wear makeup, when I was more of a sports person that would really enjoy not wearing makeup, but I always felt like I wanted to cover it a little bit. So it definitely hasn't been a heavy burden, but it has definitely been something that I've been carrying around over the years. And it would be it would be great if that could be tackled more in the future, and if we would find a cure for that.
Definitely. It sounds like it's one of those, like, really can affect a person's self-confidence, and kind of their sense of self-worth, and having all of these comments about hygiene thrown at you. It's hard to deflect that a lot. So I guess having a diagnosis at least gives you, like, I don't know, a sense of, this is what's wrong with me, kind of thing. Not that anything, actually having PhD doesn't have anything wrong with you. No, but more that it's a name to the symptom that you're experiencing.
It definitely helps accepting that, it definitely, it doesn't leave that question mark of, everyone can see that something's wrong with my skin. And a lot of people have commented on it. And I mean, my mom has it, and my grandma had it, obviously. So now we know why. And now it makes more sense. It gives you a little bit of a peace of mind, and I can definitely see that it's getting worse over the years. So it wasn't that bad when I was 20. And it's getting more and more. And looking at my mom, she has it definitely more severe than I have. And she's come to peace with it as well. But like I said, it's just nice knowing what it is, and that it's not something that you could have prevented.
Yeah, and having to live with something kind of for the rest of your life, and with the idea that it actually might get worse to some extent, is, a difficult thing to balance. And I'm really glad that your mom's come to kind of her peace of mind with it, and that, it doesn't affect her as much as it might do other people. So you mentioned that you'd kind of had some laser treatments and stuff, but how did you go about finding a good dermatologist?
Finding a really good dermatologist actually took me until I was diagnosed. Because in the same month I was diagnosed with Birt-Hogg-Dubé syndrome, I was diagnosed with skin cancer, so on my forehead. And that is something that, to my knowledge, hasn't been directly associated with BHD, but could potentially, of course, be. It was a basal cell carcinoma on my forehead that I saw growing for 3 weeks or so. And, if you have a lesion on your skin that looks suspicious and doesn't go away within that time frame, then you should definitely see a dermatologist. And I saw her, and she biopsied it and came back positive for cancer. So I had that little surgery, and that was, and then I mentioned that I also have Birt-Hogg-Dubé syndrome. I was just recently diagnosed. Like I said, that was by that time a week ago. So it was really within the same month. And that was kind of when I found an expert in Birt-Hogg-Dubé and all in general skin and dermatology. So before that, like I said, I really don't blame any physician, but you get all kinds of treatments offered, and you take them because you're kind of desperate. You try this and you try that, and you spend rather good amount of money on laser treatments, and then the lesions come back after 3-4 months, and it's it's not only painful, but like I said, also from a monetary perspective, quite burdensome. So I've done laser treatments. I've gotten tons of facials, skin, dermabrasion, things like that. And but when I was diagnosed, I kind of found my routine that works for me, and works for my skin, and that I'm very happy with, together with my dermatologist, my oncologist, and the entire team that helps me.
Good. I'm glad you've got a really good support network. And finding a dermatologist that knows about BHD does sound like a difficult thing, and that I think many people would struggle with. So it's really useful to hear kind of your story and how you kind of almost stumbled into it. What would you say that people could do, the public, patients, us as a charity could do to help raise awareness of BHD within dermatology?
Interviews like this. Spreading the word. I think just the good thing about the Birt-Hogg-Dubé community is that we are so well connected, and that we have always relied on being on spreading the word and being out there and connecting with other clinicians, patient advocates, patients. And I think this is one of our big strength, that we're able to do that. So I think having more meetings, also participating in bigger meetings, as a smaller group, but representing an orphan disease. And as we're moving more and more towards I don't necessarily like the term, but personalized medicine. The term has been a bit abused over the years, but I think the point being is that we're all individuals, and we all need different cares. And I think as we're moving towards that individual patient care more and more, it becomes less of a hurdle to have a very rare disease. So I think what we're already doing is great. Spreading the words, participating in bigger conferences, being out there, raising awareness. And there's a lot of, now that I started being in the network, there's a lot of people who actually care about it and do a lot of brilliant work. So I'm very confident that this will continue and this will raise more awareness.
Great. The future can be bright for BHD. And just to talk a little bit more about some of the treatments you've received, because it sounds like you've probably almost had everything under the sun that can be offered to you. But how did you find out about kind of what the different treatments were, and what did you take into consideration when thinking about potential treatments?
I'm always, like I said, I've always tried a lot of things, but that's also my nature. I'm always curious to see what's out there, and it might or might not work. So that's really kind of a single person study, I would say. I always describe it like that. On the other hand, there's no targeted skin treatment. So if there was one, or if there was one in development, especially for folliculin-induced skin lesions, I would definitely be one of the first volunteers to participate in that. On the other hand, yeah, like I said, the more general, more common treatments, I would say, I just tried them and figured if they work for me or if they're too harsh for me. I also at the same time have very sensitive skin. I don't know if this is associated to Birt-Hogg-Dubé or not, but everyone in my family from the Birt-Hogg-Dubé side has very extremely sensitive skin. So it was a lot of troubleshooting, I would say. And now I found a dermatologist that offers really gentle facials, and yeah, like I said, I found my routine. So, and I definitely learned to live with the skin lesions.
That's great to hear. So you've talked a little bit about how you've been able to come to terms with your skin quite well, and you found your routine that works for you. Have you had to kind of think about any of the other aspects of BHD, so the kidney, lung symptoms, and kind of it being an inherited condition, and having to come to terms with that side of things as well?
Yes, definitely. Like I said, the lung is, at least for me, pretty manageable. I'm probably not doing as many sports as I would do if I wasn't diagnosed. But the kidney, like I said, is fine right now. The one thing I keep remembering when I was newly diagnosed, I was in the department for reproductive genetics, and I was told that I would have to have IVF if I ever wanted children. I don't have children right now, and since it's an autosomal dominant disease, the likelihood is 50% that I give that to my children. And I was told that I should definitely consider IVF to kind of eradicate the disease. And I have a little bit of mixed feeling about this, because I think it's very important that we emphasize on that like I said, that we spread the word, that we raise awareness for the disease, and that we're doing more and more research on it and really getting to the basics and developing treatments. On the other hand, I personally, and this is a very personal decision, and I don't say that this is right or wrong, but for me, I would never consider IVF for Birt-Hogg-Dubé. I definitely can see how this can be a point to be discussed, but I for example would never consider that. I mean, like I said, none of the people in my family had kidney cancer, and I can definitely see how this could definitely be an argument towards that. But we know so little about Birt-Hogg-Dubé and how the single mutations affect the family, and we've also seen that it can have tremendous differences even within the same family. But for my family, my mother is 75 and she's relatively healthy. I don't think she takes any medication, actually. She recently broke her arm, but that's pretty much all I can remember. My grandmother was almost 90 when she passed. So I wouldn't want to choose, or I wouldn't want to go through something as invasive as IVF, just in order to eradicate the folliculin mutation in an embryo. So, but like I said, this is a very, very personal decision, and I'm not saying that this is right or wrong. It's just a thought that I had when I was diagnosed, and that I thought about quite a lot. So yeah, I just wanted to share that.
Yeah, thank you for sharing that with us. It's a very personal thing, and so we do really appreciate that. So you can live a perfectly kind of happy, healthy life with BHD. And it's such a big decision to go down that route.
I think, I mean, I always say, and again, if a family with BHD is affected in a dramatic way in terms of metastasized kidney cancer or something like that, this is a totally different story. But if you look at other mutations, for example, like BRCA mutations, that will give you a very, very high likelihood of developing a GYN cancer over time, in about 80 to 90%. I definitely think that this is a different story, you know, and I can definitely see how this is being treated completely different than, for example, Birt-Hogg-Dubé. And like I said, it's possible to live with it. And I think it's, at this point, we should really focus on developing individual care packages and treatments and getting to know more about Birt-Hogg-Dubé in order to really find mechanisms that we can tackle over time, rather than the aspect we just discussed. So yeah, I really think that getting to know more about it through an excellent network, such as you're providing, that would be, that is right now the most important topic.
Definitely. And having the knowledge of BHD, and you can introduce screening measures and lots of other things to try and monitor your kidneys, so the chance of developing kidney cancer is much reduced, and therefore the chance of it metastasizing and it being more serious is also greatly reduced as well. Yeah. So just kind of wanted to know what your advice would be for someone who is struggling with both the physical and mental health aspects of their skin bumps and BHD symptoms more generally.
My advice would be to get in touch with other BHD patients. I know there's great patient networks, very well connected, kind of all over the world. My mother is in the Munich area. She has a great oncologist that connected her also with different patients. And yeah, I definitely think that talking to other patients and their experiences is helpful. Doctors can definitely help in that term, but I really think that reaching out to other patients that are out there is definitely very helpful in learning to accept this disease and live with it, and just be aware of things that you can and cannot do, and screenings that you should have over time. So yeah, I definitely think that the networking helps.
I think that's really great advice. And we can say that there is a great Facebook page on for Birt-Hogg-Dubé, and if anyone is watching and is struggling to find a network of people, we at the BHD Foundation can help you with this, and we would be more than happy to put you in touch with people. And I think I have one more question, which is, what would you love to see in the future in terms of improving the quality of life for BHD patients?
A treatment for the skin bumps. Targeted, non-toxic one, ideally. As we discussed before, more broader knowledge about how this fits in to other similar conditions that have been described, really trying, I'm talking from a molecular pathologist level now, like really trying to understand where it fits in, how it's regulated, what the exact function is, having more basic knowledge about Birt-Hogg-Dubé. And then I think in terms of quality of life, like I said, targeted skin treatment would be a dream of mine, and I'm very sure of many affected BHD patients. Um, the monitoring, I want to say, I mean, if you're in a country that offers a great healthcare system, the monitoring is great. Once you're diagnosed and once you're aware of it, the monitoring works very well. I think the tricky part is not being diagnosed. And as I read more and more about BHD, I really started to think and talk to many well-established researchers in the field. I started to think about what the actual number of BHD patients is and how many are out there that have never been diagnosed. I mean, like I said, my own story is I had the first symptoms when I was 15. When I was 20, so 15 years ago, and I was diagnosed 2 years ago when I was 34. So I think what I would like to see in terms of quality of life is being that patients can be diagnosed earlier, which brings us back to our original point. How can we spread the word, and how can we make sure that people are more aware of Birt-Hogg-Dubé? So I think this is a very, very important message.
Definitely, and raising awareness is something we are very keen to do, and yeah, we'd love to get involved with you and with other patients, and trying to establish more ways of how we can raise awareness of BHD among all different groups of people, from the general public all the way through to researchers and clinicians, because that will be probably the most important thing. An early diagnosis can make a huge difference to someone's life.
Yeah, and I'm very, very much looking forward to more in-person meetings, and really hoping that the annual Birt-Hogg-Dubé meeting is coming back in person soon, so we can definitely, I guess, network a little easier. And like I said, also participate, spread into bigger conferences, kidney, lung. I mean, it's such a broad field, where definitely patient advocacy groups and or scientists should participate in. So
definitely,
yeah, very much looking forward to in-person meetings again.
Fingers crossed for our BHD symposium happening in person next year.
Yeah.
Right. I think that is all the questions I have for now. So I'd just like to thank you so much, Julia, for answering these questions, taking the time to talk with me, and just really appreciating your honesty about your journey with BHD and how it's affected you. And I really think that a lot of people who will watch this will be really inspired by you.
Yeah, thank you so much, Katie. This was really great.